All right, good morning, everybody. Thank you for joining us for our press briefing on the state's response to the pandemic. As always, we remind folks that we need to continue to practice our good social distancing rules, keeping that 6 foot of distance between yourself and other people when you're out in public. Wear a mask when you go to the store. Wash your hands often, 20 seconds at a time. That actually kills the virus and will help slow the spread of the virus. Try to work from home if you can. Please stay home if you're sick. That will help us avoid spreading the virus. You can always go out and get tested to make sure it's not coronavirus, but if you've got any of those symptoms, please stay home. And of course, if you're sick, you're always supposed to stay home anyway. So please stay home when you're sick. When you're going shopping, obviously the Christmas season is coming upon us here. People are doing shopping. Please go by yourself. Try to limit the number of trips to the store. Don't take the whole family with you as you go to the store. And just in general, when you're going to the grocery store, try to go once a week by yourself. These are all steps that will help us be able to slow the spread of the virus. We also would like you to avoid the 3 C's. Crowded places, confined spaces, close contact. Again, this is a virus. It spreads from one person to another. So if you can avoid the 3 C's, you will also avoid the opportunity to be able to spread that. Which means, again, as we think about the holidays, those holiday parties, be good to either try to postpone those till maybe in the spring or limit the size of those to be able to slow the spread of the virus. And of course, you want to take a special care here, especially as we're thinking about Christmas and Hanukkah coming up. You want to visit with family. Now's the time to really slow down, to make sure you're not presenting yourself with the opportunity to catch the virus, because if you do, you're going to have to isolate, and nobody wants to be sick over the holidays, so please try to avoid that. And certainly, nobody wants to end up in the hospital over the holidays. So please help us slow down the spread of the virus. As always, what we're trying to do is minimize those hospitalizations to make sure we can provide that acute care for the people who need it when they need it. Right now, our hospital capacity is at 28% of our hospital beds are available, 26% of our ICU beds are available, 71% of our ventilators are available. And as you can see, we've got the chart right here. We're at 787 hospitalizations statewide right now. We are below the level for the dropping from orange into yellow. That works if we get 7 days in that yellow on a rolling average. So again, if we can continue to be able to slow down the spread here and reduce those hospitalizations, we may ultimately be able to change the way that, what the restrictions that we have in place. Test Nebraska is another way that we can help slow the spread of the virus. Using that to be able to, again, with the holidays coming up, get yourself tested before you go. That will help make sure that you don't have the virus. It is just a point in time, but it'll also give you some comfort to know at least at that point you did not have the virus. And so that's always an opportunity out there. We have had 571,000 Nebraskans sign up for Test Nebraska. We have delivered over 505,000 tests now through Test Nebraska. And we've got great news here today. We will be increasing the scheduled slots here in Lincoln at the Gateway Mall there. We will be going from 1,100 slots per day up to 1,500 slots per day starting today. Is that right, Angie? Starting today. Great. So we were able to, we talked about this pod that we had implemented from Pacific Engineering Incorporated, which is a Lincoln-based company here. And they built that actually they built several of those for us. We've got 2 of them installed here in Lincoln. It's kind of like, think about it, almost like a 2-car garage. We've got 2 of them together here in Lincoln to help protect people from the inclement weather. Probably not going to be necessary today, but maybe on Friday. So we want to keep those folks protected from the weather. And so now that's allowed us to ramp up the schedules available here in Lincoln. All right, so today we're going to do a vaccine update. As you may recall, we've talked about how the FDA is going to be reviewing the Pfizer application tomorrow. And if they grant emergency use authorization for Pfizer, then we will be getting shipments here in Nebraska to be able to start distribution. We expect those shipments to arrive sometime the week of the 13th of December, through the 19th. And we've put together our prioritization plan, which is out there published on our website. Phase 1A includes hospital workers, long-term care workers, emergency EMS, so the folks who may be interfacing with people who are coronavirus positive, and then long-term care residents. And I do want to stress that, for example, with the hospitals, that we're talking not about everybody in the hospital system. We're talking about people who are going to be prioritized who deal with potential coronavirus patients. So for example, a nurse working in an emergency room is an example of that. Whereas somebody who maybe just works in the office is not going to be a part of that group to get the vaccine. So again, we're prioritizing people who may be interfacing multiple times with coronavirus patients. We're also going to be protecting our vulnerable populations, especially in long-term care, and that's why long-term care workers and long-term care folks, residents, are going to be a part of that first group as well. We're still expecting to get about 15,600 in that first shipment, and again, they'll be going out to those hospitals that can handle the ultra-cold storage. The Pfizer requires that ultra-cold storage, which means minus 60 to minus 80 degrees Celsius, or about minus 90 degrees Fahrenheit. So you can see that's got to be really cold. So anyway, so that's kind of the program. We do have our incident commander, Angie Ling, who is here for the Department of Health and Human Services, state of Nebraska, to go into more detail about updates to our vaccination plan. We do update our vaccination plan periodically based upon the work that we're doing here in the state or the guidance from the CDC and so forth, so that plan will get more detailed and more evolved as we go forward. So Angie, I'm going to ask you to come up and just talk a little bit about where we are with regard to the vaccination plan.
Good morning. Thank you, Governor. First, I'd like to talk about National Influenza Vaccination Week, which is this week. This is a nationwide call to action to encourage those who have not already done so to get their annual flu shot. Annual flu vaccination is recommended for everyone 6 months of age and older and is an effective way to decrease flu illness, hospitalizations, and deaths. A flu vaccination this season can also help reduce the burden on the healthcare systems as they continue to respond to the COVID-19 pandemic, and will help save medical resources for care of COVID-19 patients. In the 2019-2020 data, the CDC estimated that in Nebraska, 68% of children 6 months to 17 years old received a flu shot, placing Nebraska in the top 20 states nationally. 49.9% of adults ages 18 to 64 and 75% of 65 years and older also received flu vaccine last year as well. Wearing a mask, social distancing, and hand hygiene will also help protect you from respiratory illness, flu, and COVID-19, but the best way to prevent flu illness is getting your annual flu vaccine. There are multiple locations to receive your flu vaccine each year, to include your doctor's office, health departments, and pharmacies. If you need assistance finding a location, please visit vaccinefinder.org to help you find a location close by. I would also like to take some time to give some updates on the COVID-19 vaccine. The FDA's advisory committee will discuss and vote on emergency use authorization for Pfizer vaccine on December 10th and Moderna's vaccine on December 17th. The Advisory Committee of Immunization Practices, ACIP, will meet on December 11th and 13th and will vote on vaccination guidance. We need approval and guidance from both of these groups in order to proceed with the vaccination process. ACIP has recently made some updates to the Phase 1 structure, and we will be following their guidance. Our state vaccination plan was updated on December 7th and can be found on the DHHS website. The new Phase 1 will be broke out into A, B, and C. 1A will consist of healthcare and long-term care facilities, as we've mentioned previously. 1B will be first responders, the education sector, food and agriculture, correction staff, utilities, and transportation. 1C would be the 65 years and older population, vulnerable populations, and congregate living. We submitted orders last week for the first allocation of the Pfizer vaccine that we anticipate receiving next week. Due to security considerations, we will not be giving out specific locations of these allocations. The Pfizer product will be going to 8 hospitals who will be supporting an additional 9 hospital systems with this initial product. We have asked the hospitals to prioritize within their systems to vaccinate those caring for COVID patients day in and day out. Some examples would be the emergency department, COVID care units, and local EMS. We will also be activating the long-term care federal pharmacy program. This program has allowed long-term care facilities to align with a pharmacy who will complete their staff and resident vaccinations. There are over 400 long-term care facilities using this program. Those facilities who did not select a pharmacy will work with the local health departments to get their vaccination. As the vaccine planning progresses, we want to ensure we are providing updates in a timely manner. As I have mentioned previously, this information changes frequently. On Monday, we were notified that there will be a delay in week 2 and 3 of Pfizer vaccine product, but have not been given additional details of when it will be available and if the quantity will be changed. As always, we will continue to keep everyone updated on the status of vaccine product coming to the state of Nebraska. Thank you.
Great, thank you very much, Angie. So just to reiterate there, we have been notified that Pfizer shipments will be delayed for week 2 and week 3. We've not been told what that actually means for us. And of course, then we still will be having, assuming Moderna gets their emergency use authorization on December 17th, we will still be able to distribute Moderna. Again, that we would expect to get that the following week after the 17th. So just wanted to get that announcement out there with regard to that. And then, as Angie also said, she mentioned we're breaking down phase 1 into those different phases, A, B, and C. Similar to like we're doing hospitals, where we're talking about we're prioritizing people within those groups, we will be prioritizing people within those other groups as well. So, for example, you can imagine in a transportation company, not everybody will need to get the vaccine early on. It'll be the people who actually are important to make sure, for example, the trucks are able to run, drivers and mechanics, not necessarily office staff people. So, again, we will be making more announcements with regard to that and getting more detail with regard to who will be eligible to be in those groups as we work through this to be able to prioritize the people that are going to help us make sure that we can take care of folks who are infected with coronavirus or keep everything else running here in the state. So with that, also want to highlight that Operation White Lights is something to recognize our healthcare workers. This was something that CHI Health has announced yesterday or the day before, and really what it's encouraging everybody to put on white lights on their homes or on their businesses, wear a white ribbon, and it's really to recognize our healthcare workers who have been doing so much to take care of coronavirus patients these last 9 months plus. They've been working very, very hard, been very stressful conditions, had to learn a lot of new things to be able to take care of coronavirus patients, and so we just want to continue to recognize them for their hard work. So Operation White Lights, thank you, CHI. The upcoming schedule, obviously, as I mentioned before, we're going to have a 10 a.m. press conference right here on Friday. And then next week, Monday and Wednesday, 10 a.m. Monday and Wednesday at 10 a.m. Friday will be at 9 a.m. due to the State Patrol graduation. So next week, 10 a.m. Monday and Wednesday, right here. We will move this press conference up 1 hour till 9 a.m. on Friday due to the graduation ceremony for the Nebraska State Patrol. And then we'll go ahead and get into some questions and answers here. And actually, maybe I'll just wrap up on that Operation Warp Speed. My understanding is that they're planning on still producing about 20 million vaccines here by the end of the year and distributing those. It'll be 60 million by the end of January and 100 million by the end of February. So they've got a very aggressive time frame for getting all those vaccines out. And that will mean that we should, if they meet those kind of production schedules, still have, again, the vaccine available for the general public probably in that April timeframe we discussed earlier. Okay, Julie Anderson, the Omaha World Herald. Dr. Cliff Robertson just mentioned that CHI expects the first shipment as early as this weekend, and if it arrives, they would give the first doses early Monday. Does that match the state's timeline? If not, what is the first shipment expected? Again, all this is dependent on the FDA. The FDA has to approve the emergency use authorization. Then the shipments have to be shipped out. Yeah, they have to be shipped out, and we have to receive them. That'll all be dependent on that. Again, we're still sticking with the timeline we said, which is December 13th to the 19th is when we would expect that first shipment of 15,600 Pfizer vaccinations. And then also remember that when we're talking about those doses, the federal government is holding back the second dose. The first dose, so the Pfizer dose is 2 doses, 3 weeks apart. And actually, I think Dr. Gruber from Pfizer said that the first dose will give you about a 52% effectiveness on that vaccine, but you need to get both doses to get the 95% effectiveness. So we're going to have to make sure everybody gets that second dose. And the federal government can be withholding that until after that 3-week time frame. So you can see that second dose wouldn't come until January. How many doses are expected the first shipment? The 15,600. Will shipments go directly to hospitals? Yes, so that we will, as Angie said, we will ship those directly to hospitals. Okay. Can you go over where we stand with CARES Act money distribution and how much is left and yet to be allocated and so on? Again, you can find all that at coronavirus.nebraska.gov. We've got a list of all what Deloitte has done with regard to the distribution of those dollars. So I just encourage anybody who wants to get information on it, just go to coronavirus.nebraska.gov. That was from Kevin Westhughes from WWT. And then Mark Jackson, Burt County Plain Dealer. When the first shipments of vaccine arrive in the state, how much, if any, will be directed to rural areas? Again, we're not, for security purposes, we're not going to say which hospitals they're going to, but it will be working the entire state to be able to get those vaccines out. As Angie mentioned, it'll go to 8 hospitals who will then work with 9 other hospital systems to be able to get those distributed, focusing on those hospital workers first. So that's going to be the first priority. Again, people who are facing coronavirus patients. Presuming Moderna gets approved on the 17th, that is a vaccine that does not require the ultra-cold storage, and so we will leverage that for other parts of the state that maybe don't have the ultra-cold storage. So that would be going out the week following the 17th, so the week after. All right, so those are all the questions that I think we had submitted ahead of time. Taylor, did you get any others?
I do. Lauren from the Norfolk Daily News has a couple questions. Do you have more details on how the coronavirus vaccines are distributed to frontline workers? Will agencies administer them all at once to workers, or are there additional steps that need to be taken?
So Lauren from Norfolk Daily News is asking about additional details with regard to the vaccines. Again, and she wants to know, are they going to be administered all at once, or are there additional steps that have to be taken? The Pfizer vaccine may have some side effects like a sore arm or maybe some fever in some folks. So what I imagine hospital systems will do, they'll phase that in as they roll that out to their workers so that they don't, for example, have everybody who gets the vaccine get a sore arm and not be able to do their jobs or whatever. So I imagine the hospitals will phase it in over a period of time as they get their staffs vaccinated. But again, this is only going to be toward coronavirus, people who are dealing with coronavirus patients.
Lauren also says they've been told that coronavirus vaccination does cause symptoms for about 2 to 3 days after it's administered, which will cause those who take it, including essential workers, to stay home from work during that time. Can you confirm this, and do you have additional detail on this?
So Lauren's just asking about side effects and, again, having a fever and maybe having to stay home. In some people, it may cause that. We'll really need to wait until we get the FDA information out, which hopefully will be tomorrow. All that information will become public, and then we'll have a better idea of how often that may occur. But again, this is why I said the hospitals will probably phase in how they do these vaccinations so that they don't have the potential for the whole staff having to stay home because they've got a fever or whatever.
Jeff Robb from the World Herald says, can you repeat the classifications in phase 1, A, B, and C, and how many people are in each phase?
So again, we can't give you the number of people in each phase because we're still going through exactly who within each of those different groups will be eligible to get that priority vaccine. But Angie, could you come up and go through that phase 1, A, B, and C again, please?
Okay, so for phase 1, it would be healthcare and long-term care residents. Phase 1B would be first responders, the education sector, food and agriculture, correction staff, utilities, and transportation. And phase 1C will be the 65 years and older population, vulnerable populations, and congregate living facilities.
Bailey Bischoff from 1011 says, at what time frame do we expect phase 1A to end and phases 1B and 1C to start?
So Bailey Bischoff is asking from 1011, when do we expect phase 1A to end and then starting into phase 1B? And again, that's entirely dependent upon the shipments. We've been told what we might be able to expect, but as we've just announced, Pfizer's already, that has already changed since our last press briefing on Monday. When we've now found out that Pfizer is potentially being delayed for week 2 and 3. So it really just depends on how these work out. Again, we'd originally estimated about 100,000 vaccines being received in the month of December. It may not be that much. In that first category of just potential hospital workers and long-term care workers and long-term care residents, that more than exceeds the allocation we thought we were originally going to get for December. So again, it just depends on how many we get and how, how quickly we can get through that first phase.
Bailey also says there's been a lot of people saying they don't trust the vaccine and won't get it. What would you say to those people, and would you encourage them to get the vaccine when it's available to them?
So Bailey says that some people are saying they don't trust the vaccine or are not going to take it. I would certainly encourage people to do their research on it. If the FDA comes out and approves the Pfizer vaccine, I would have no problem myself personally taking it or recommending somebody else to take it, but we certainly want people to feel comfortable. So when we have that data, please, go do your own research on that. But again, one of the things that the FDA has done is they have done much larger groups of people doing the test. So for example, typically for a vaccine, you might have, say, 5,000 or 6,000 people in that test group. Well, they're doing 30,000 people in these test groups as a way to collect more data more quickly to be able to assure that it's safe and effective, and that's how we get to 95%. And frankly, should the FDA actually validate the data bears out 95% effectiveness, that's actually pretty remarkable. That's pretty amazing that Pfizer and Moderna have been able to develop a vaccine this quickly with that kind of efficacy. So that should also give you confidence that this has been a great process and feel confidence that you can take that vaccine.
She also asks, is there a concern that if we drop down to the yellow phase of the DHHS, it will cause hospitalizations to jump up again?
So the question was, if we drop down to the yellow zone, could that cause us to have hospitalizations go up again? And that's why certainly we want to encourage people, don't let your guard down now, especially with the holiday season coming up. Good time to slow down to make sure you're not sick for the holidays. And should we go into the yellow zone, we'll still need to continue to practice all those good social distancing rules. And we're going to need to do that really through the entire winter. As we've said, general population vaccines are probably not going to be available until April, which means then we all need to keep practicing all of our rules. And again, if hospitalizations start climbing again, then we may go back up into the orange zone, and we would have additional restrictions.
Is the state helping provide the ultra-cold storage to rural hospitals who may not have the resources?
Is that from Bailey as well? So Bailey's asking, is the state helping with rural hospitals that don't have ultra-cold storage to provide that to them? What we're doing is actually going to be using, for areas that we cannot provide the ultra-cold storage to, the Moderna vaccine to be able to help cover those areas, as well as the hospitals that do have ultra-cold storage, working with their satellite hospital systems that don't.
And then Bailey's last question is, how will people find out they're eligible for the vaccine, like those in phase 1C who may not be getting the vaccine due to their employment?
So how will people find out if they're eligible for vaccine? I'd say just stay tuned. We're working through all those plans right now. We're very much focused on making sure we get this first batch of 15,600 out to those hospital workers, but we'll have more information as we get further into the different phases.
Chris from NTV says, is the state still focused on mental health during the pandemic?
Chris says, is the state still focused on mental health during the pandemic? And the answer is absolutely yes. Obviously, our Department of Behavioral Health, that's their full-time jobs, is focusing on this sort of thing. We've talked about mental health actually in a number of these press briefings. So when we're talking about, you may recall the campaign that we had to slow down the spread. We talked about staying connected. We encourage people to continue to stay connected. That especially if we're slowing things down now during the holiday season, please find other ways to stay connected to your loved ones, Zoom calls or phone calls or what have you. But yes, we want people to continue to stay focused on their mental health.
And then lastly, another one from Jeff Robb. Are long-term care staff in 1A, and what type of responders are in 1B? First responders or just EMS?
So Jeff Robb from the World Herald is asking, are long-term care workers in 1A? And the answer is yes. So we're going to be working both on the long-term care residents and the long-term care workers in phase 1A. And then, I'm sorry, what was the second question? What type of responders are what type of first responders are involved in phase 1B? And again, we'll be getting out more details with regard to those other phases as we work our way through phase 1A.
That's all I got.
All right, great. Fred?
What were the changes in the December 7th state plan from what was originally?
You mean the December 7th one? Oh, I just talking about how we originally thought that we had made an announcement with regard to what we thought the Pfizer vaccines were going to be, how many were going to come in the first week, second week, and so forth. And we're still being told we're going to get the 15,600 in the first week, but I think it was 19,000 in the second week or something. And we've been told that's been delayed, and we've not been told what that means. We don't know if that means fewer vaccines, if it'll be the same vaccines just in week 3, but we've just been told that the Pfizer vaccine for weeks 2 and 3 have been delayed.
So it sounds like if you, even under the original plan, there were more people in phase 1 than vaccines.
That's correct.
Prioritize within 1A, is that going to be hospital workers, then long-term care workers, then long-term care residents, or how does that work?
Yeah, so with regard to Fred's question is, like, even with what we originally had, you're still gonna have to prioritize the groups because we're not gonna have enough for everybody, certainly day 1. And yeah, so what we're gonna be doing is we're shipping to those hospitals first as the first priority. To be able to do long-term care residents, the federal guidelines are you have to have 50% of your shipments, your vaccines available to start the long-term care program. So again, if Moderna comes on board, or, well, I guess that's going to be for another part of the state. As for the Pfizer ramps up, so we have the 50% for the long-term care facilities, then we would be rolling out that program. So it's going to start with the hospitals.
And what is 50%?
So my recollection is, and Angie, I'm going to have you come up and actually talk about the numbers so I don't give out bad ones. How's that? Do you have those numbers?
I have the full works.
It was about 50,000, was it 49,000, right? In between long-term care workers and, what, yeah, what you want to
Okay, so for the vaccine program, we need about 20 to 25,000 vaccines available to be able to activate the program. So we're anticipating for long-term care staff and residents to be close around 50,000 vaccines allocated to that group.
55,000?
50. Staff and residents. So with the pharmacy program, they will be vaccinated together. So the pharmacy will go in and vaccinate all staff and residents at the same time.
Okay, so sorry, hospital workers first, then long-term care workers and residents when there's.
So it won't necessarily be tiered like that. So the Pfizer vaccine that we are allocating first goes to these 8 hospital systems. And so they will be receiving that first allocation. Now, as the weeks go on, we will be getting both Moderna and Pfizer vaccine. So some Pfizer vaccine will still go to healthcare. Some Moderna product will be going to healthcare. But at the same time, concurrently, long-term care staff and residents will be started. As soon as that second Pfizer allocation comes, that's when they will be started.
Right, but when you say it goes to the hospitals, that's the physical location where it goes. My question is, does that mean that the hospital workers are the first ones to get it?
The hospitals will be working with their communities, so EMS and hospital workers and public health departments will all be included in that, and that will all be worked with in the hospital system. Does that make sense? Okay, thank you.
Thank you, Angie.
We have another question from Jeff Robb. He says, what is the thinking in moving up food, ag, utilities, and transportation as a priority?
So the question from Jeff Robb at the World Herald was, what is the thinking of moving up transportation, agriculture, what else did he say? Utilities and so forth into phase 1, and that is really around that critical infrastructure. And so that's not new, that's just, I think, a further definition of what we're talking about with regard to critical infrastructure. Is that right, Angie? She's saying yes, that's right. Yeah, Andrew.
Governor, when it comes to testing, and UNL just announced that they're going to do mandatory testing. They're going to go to saliva, a spit test kind of, and it has that's a rapid test which goes back to 24-hour turnaround time. Have you thought about, changing Test Nebraska into a rapid test type of a thing? Would be, a little bit easier to use than the nasal swab, like a spit test?
Yeah, so the question, Andrew's asking the question, with other types of testing coming available, like the university using the saliva test, have we thought about changing Test Nebraska into more of the more rapid tests? And certainly we've considered that, but right now the PCR test is really the gold standard for accuracy. And so we're going to stick with that for right now with regard to that, because we just think that that is the gold standard. It's 95% accurate. We've been able to test that in our labs. So that's what we're going to be sticking with for the time being.
Is the accuracy getting better on those saliva
The question is the accuracy getting better on the saliva tests? And we don't have any data to be able to know exactly what the accuracy on that saliva tests are, other than what the companies are reporting. So as those tests become more widely available, we'll probably do our own test here at the state of Nebraska and validate them. But right now, I don't really have any information on how accurate the saliva tests are. Other questions? All right. Oh, Paul, I was wondering, you hadn't asked any questions. I'm like, Paul's sitting here, he's not asking a question. I guess he's.
Initially, you were thinking the state would get 100,000 by the end of the year. Do you have any idea where that might land now?
So Paul is asking the question, we thought originally we'd get 100,000. Do we have any idea where that might land? And we really don't. We've been told Pfizer's been delayed for week 2 and 3, but we don't know what that means. So we've not been given any specific numbers for that.
The vaccine needs 2 shots. Are you going to try to prioritize the shipments so you get somebody their 2 shots before you start vaccinating somebody with their first shot? How are you going to do that?
So the question is, because it comes in 2 shots, are we going to try and stagger that? So the federal government is actually going to be withholding the second dose of that vaccine, so to speak, until after we get out the first dose. So again, the people who are going to get prioritized to get the first dose will get then prioritized to get the second dose. And as we roll those out, we'll come up with more complete plan. But the federal government is we really got to tie the person who gets it the first time to that second dose. The federal government's really kind of holding back that second dose till you get the first dose out.
So they're different.
As far as the vaccine themselves, I don't know if it's much different. I know you have to have 2 doses to get to 95% effectiveness, and the federal government said they're going to withhold that second dose until you actually get the first dose out. Yeah.
I guess maybe what Paul's asking is the 100,000 doses included in the doses that are holding back?
So the 100,000 doses is the first dose, initial dose. So that's not included in the doses that are held back.
So within the end of the year, we may have more than 100,000 because of the doses that were held back.
Well, again, the federal government's going to withhold the second dose. So say we got 100,000 doses in December and you need 3 weeks time frame, they wouldn't ship any of the second doses in December, right? They'd all withhold that until this January.
Where do you fit in the 1A, 1B,
Paul's asking, where do I fit in this? I fit in the general population.
We didn't make a governor's category?
They did not make a governor's category in this, no. I don't regularly interact with people who are coronavirus positive, hopefully, so I'm not included in that category for prioritization.
Which you don't know if you.
Well, again, this is why we all got to continue to practice our, Andrew says, but you don't know. And I think that the thing is, that's why we all got to continue to practice our good social distancing guidelines and keep that 6 foot of distance and wear a mask when you go to the store.
And I don't know if anybody in the room could answer this, but what have we learned from the short time that the UK has started vaccinating?
And so Andrew's asking, what have we learned, if anything, from the UK vaccinations? I believe they just started vaccinating people yesterday, so I don't know that we've had a chance to learn anything from Angie, I'm going to look at you. Nope, she doesn't.
They just started yesterday.
Just started yesterday, so it is really too soon. So,
So is the stuff that's in the bottle for the first dose and the second dose the same stuff?
is it the same stuff for the first dose? Yes, it's the same stuff. Same stuff. Same amount? Yes. Same stuff, same amount.
So the fact that they're withholding the second dose just means they're withholding
The allocation. So withholding the second dose is withholding the allocation. Right. Taylor.
Kellen from KLN has a question. If the number of people in any phase outnumbers the amount of vaccines received, will the next phase have to wait until all the people in the phase before are vaccinated?
So the question is, if the number of people outnumber the number of vaccines that we have, will that mean that you have to wait to get through the first phase to get to the second phase? And I would say, again, we're still working our way through the entire plan, so this is a generalization, but generally we're going to focus on getting the first phase, phase 1A, done first before we start phase 1B. Now, that does not mean, however, that if we have a few folks that haven't gotten inoculated in phase 1A, that we may not start phase 1B because of just logistics and how we're getting those vaccines out. So, I would say, don't think of it so much as a hard and fast line as a continuum of who we're going to be prioritizing first and then moving into that second group as we have more vaccines available.
And then Jeff Robb has a follow-up question. What is the security risk against hospitals if they're identified as holding vaccines?
So Jeff Robb's asking, what is the security risk against hospitals if they are holding the vaccines? And again, just like any sort of security issues, we don't talk about those things, Jeff, so I'm not going to talk to you about any specific threats against that. Again, just for security purposes, we're not going to release the names of the hospitals or the timing of when they're actually receiving the vaccines.
You have to wait 2 or 3 weeks between your first shot and your second shot. Is there a time past which it becomes less effective? I mean, if you have to wait a month or 2 months?
You want to come up?
Wait until the FDA puts out the information.
We should wait until the FDA puts out their information. That should become publicly available tomorrow. Oh, so Paul was just, or Fred was just asking, is there, you have to wait 3 weeks between the first dose and the second dose. If you wait too long, does that mean that the first dose isn't effective anymore? And we'll have to wait till the FDA comes out with their information tomorrow. Paul?
So, when you get your second shot, are you gonna say, now you're okay, you don't need to, you're not gonna recommend wearing a mask?
So the question was,
Are they free and clear?
so the question is, hey, if you get that second vaccine, you're 95% likely not to be able to get the coronavirus, do you have to wear a mask? And we'll have to wait and see what the FDA comes out with regard to the recommendations tomorrow. Yeah, Andrew.
Hey, do you have any update on that computer glitch, or, with the grants to small businesses?
Sure. Andrew's asking about the grants. The deadline is today, by the way. If you think your application was somehow not handled in an appropriate way. So I think it was referred to in the World Herald as a glitch. What the actual situation was is if you did not save your application, you had to do two things as you were going through the grant application. You're supposed to save it and you're supposed to submit it. The vast majority of people did that. We had 193 people who didn't either save it or submit it. They may have saved it and then not submitted it, or didn't follow the complete directions to be able to get the grant application submitted. So we have gone back and contacted those 193 because we did have a record, Deloitte did have a record of who had actually started the application process. In fact, I know that some folks that didn't complete the grant application, we had sent back to them, say, hey, your grant's still pending, you didn't finish your application. But we have proactively reached out to those 193 people, and I believe that based upon the audit trail of when they actually started the application, whether or not they were eligible, because a number of people, we had 10,881 applications, and not all of them were eligible. There were a number that were not eligible. And some were not going to be able to get the grants because we had more demand than we had ability to fulfill those grants. But for the folks who we were able to determine were eligible and within the timeline, we are going back and fulfilling those grant applications out of those 193. I think it's a couple $1 million, something like that along those lines. So we did go proactively back to those folks who didn't either submit their application or whatever, but we could see that in the audit trail electronically, and we went back and contacted those folks.
And how much were you shy that, if people who were eligible that wanted it but couldn't get it because you ran out of money? And is there a chance you might backfill that with any unused money that you might find someplace else?
So the question Andrew was asking was, how much were we shy in some of those categories? I don't have that information right off the top of my head with regard to that. And then you said, would we go back and backfill some of those grants? It's possible we might do that, but I really don't want to hold out any hope because we've really allocated all that money. So obviously we've got till the end of the month to be able to get those dollars out the door. But I don't want to create any false hope in anybody that if they were turned down that they might somehow get the grant funded now. And like I said, some people just were not eligible. Any other questions? Paul?
You had a good relationship with President Trump. Have you reached out to the Biden camp, and do you expect to have good relationships with the president?
The question is, do I expect to have good relationships with the incoming administration? And certainly they've contacted the office about their transition planning. I would hope that they would want to have a strong relationship with governors. The previous Democratic administration didn't really cultivate relationships with governors. So I think the Trump administration did cultivate those relationships with governors, and I would hope the Biden administration would do that as well. So the question is, when do I personally recognize Vice President Biden as the new president? When enough states certify their election results to get to 270.
Will that happen on December 14th?
And the question is, will that happen on December 14th? And I got to tell you, it depends on the status of lawsuits and things like that. Off the top of my head, Andrew, I don't know that answer.
And what about that argument that, the longer this goes on, the more it tears down the institution of democracy and voting?
And the question is, the longer this goes down, does it tear down the institution of democracy? Actually, we've got a legal process in this country to resolve disputes. I think that that's one of the things that's great about our country, that when you have close elections like this and election results are disputed, we have courts of law, that we have a legal process to follow, and that's what both sides are doing. I've had comments from people in other parts of the world that have, and you may recall back when we had the Gore-Bush election, it was very, very close. Back then, people were telling me that in other parts of the world, if it had been that close, there would have been a civil war. But we don't have any danger of a civil war here because we have a system of laws where we follow the process of law and it does get resolved. Sometimes it's a little bit slower than maybe people would like, but it does get resolved in a way that is peaceful.
Texas Attorney General filed a new lawsuit contesting some of the results. Would you urge our Attorney General to join into that lawsuit?
So the Texas Attorney General has filed a lawsuit against some of the battleground states. I think that's what you're referring to, Paul. And I've talked to the Attorney General. My understanding is he is reviewing that right now.
Would you already urge him to join?
The question is, would I urge him to join? It would have to be, the Attorney General is a legal expert. I didn't get a degree in law, so it would have to be based upon the merits of the case. And again, I just found out about this yesterday, so it would really be up to the Attorney General to determine whether or not it's got legal merit.
At what point do these lawsuits become kind of frivolous?
Question is, what point do these lawsuits become frivolous? Well, we talk a lot about frivolous lawsuits, even outside the context of when we're talking about elections. Again, it's part of the process that we have here in this country that actually preserves, our system, right? That we have a way that is a peaceful way through our system of the courts and laws to be able to resolve disputes, that we don't have to resolve to, other means like rioting in the streets or something like that to resolve these things. And that's one of the reasons why we have such a strong system here. So you've got to let the aggrieved parties be able to go through that process. Have enough states certify the results? I don't know the answer off the top of my head, Paul. And again, there may be legal challenges out there as well.
How important is December 14th, I guess, when the Electoral College meets?
How important is December 14th? Well, when the Electoral College actually casts their votes, assuming no court stops that in the meantime, that becomes the official result.
Is that when you would recognize President?
He will have the 200, if he gets the 200, I assume he will, but if he gets the 270 Electoral College votes, that's when he becomes the president-elect. All right, I don't see any other questions. Again, folks, thank you very much for joining us. We'll be back here again. Let's see. Today's Wednesday, right? So it's 9 a.m. or 10 a.m. this week, and then the following week, 10 a.m. on Monday and Wednesday, and then Friday will be 9 a.m. Just want to remind people to change in the schedule for that Friday. Is that December 18th? State Patrol graduation. Anyway, thank you all very much. Again, please remember, folks, continue to practice our good social distancing guidelines. Keep that 6 foot of distance. Wear the mask when you go to the store. Wash your hands. Stay home when you're sick. Work from home if you can. Go to the store once a week by yourself. All these things will help us slow down the spread of the virus. We need Nebraskans to continue to maintain that, and especially during this holiday season. You don't want to be sick or in the hospital over the holidays, so please help us all slow down and be able to slow down the spread of the virus. Thanks very much, and we'll see you all on Friday.